Well, Duke is actually a powerhouse for urogynecology, and it is well known across the country basically that people who train Duke Urogynecology have one of the most outstanding trainings when it comes to not only clinical practice but also research and mentorship and just, a diversity of opportunities in here basically as an institution. So on one side, we are exposed to a group of 8 different faculty, some of which train here at Duke, some of whom are coming from outside. So as a trainee here at Duke Urogynecology, you get to work with so many different styles and you get to learn so many different techniques. We have a great balance in terms of routes of surgery. We do a little bit of vaginal surgery, a little bit of robotics, a little bit of laparoscopic surgery. So as a trainee, you really get the full breadth of clinical practice and surgical exposure. We recently had a new faculty join us, and she actually brought a huge variety of congenital variances and different anatomic variances that have exposed trainees actually to a new group of basically very complex and intricate vaginal procedures that have definitely enriched what we do here as trainees. One of the unique aspects is that actually our clinical volume is above the national average for all the different cases that we do. And not only do we do vaginal surgery, robotic surgery, and laparoscopic surgery, but we also do, for example, intrastim and sacral neuromodulation for the treatment of overactive bladder. We actually have one of the largest implanters across the country, and we, as trainees, get exposure to a lot of the preoperative aspect of that, as well as the surgical management, and then the post-operative care and the management of devices in the office. In the office, we also have a very large clinical volume and very busy practice. We have 2 nurse practitioners, we have a physician assistant in the office, and we get exposed to a wide variety of office procedures, which actually also contributes to making us very well-rounded clinicians when we go out there to practice. In terms of the clinical experience, I think we're lucky enough to be able to work at main Duke University Hospital and have our main office and our headquarters in Durham, but we also have the opportunity to go and spend about maybe 25% of our training out in Raleigh, where there's a little bit more of a community vibe or sense to the kind of clinical training that we get and also the kind of patients that we work with. So I think even in terms of the patient demographics and the patient populations that we work with, we're also very fortunate to be able to work with different groups of people. In terms of the research experience, we work with huge names in the field, people and faculty who have pioneered some of the most important trials in urogynecology. So not only do we get their mentorship and all of the connections that they've created within Duke as an institution, but also with other institutions and urogynecology groups across the country, but we also have a dedicated group of research coordinators that work with the fellows in the office to help not only with recruitment, but also with all the regulatory processes that go behind doing research. Things like getting your IRB set up and approved, things like working with patient compensations, things like working with recruitment with different materials to inform patients of the different research trials that we have going on. So we are very well supported. Also through the Department of OBGYN, we get funding and we get statistical support, which is very, very useful for those of us who may not have the strongest statistical background. And then lastly, some of our attendings actually are part of the PFDN, the Pelvic Floor Disorders Network, which, when it comes to urogynecology is probably the main research infrastructure and institution per se that, rules the kind of research trials that we do in our field. So we are lucky enough to work with people who are very involved in the process and who basically serve as avenues for us to also get connected with different writing groups within the PFDN. What I remember most about my fellowship is the great time that I've had with the people that I work with and the faculty that have trained me over the last few years. And I remember coming in, it was almost intimidating to think about working with some of the biggest names in the field. But at the end of the day, everyone has been so nice and so friendly that it's been a true pleasure to work with all of them. And I'm sure that down the road in the next several years, as I become an attending and I go out there to practice, I know I can count on all of my attendings and my faculty here at Duke to just give them a quick call and ask for a second opinion or for advice or just, to run something by them. And I think that's a huge pleasure and, a huge privilege. My career goals after finishing at Duke Urogynecology is to go out in the field and become, a well-rounded clinician, hopefully with some kind of research component to my practice as well. And within, the potential geographic restrictions that I may have after practice, I hope to keep giving back to the community and keep giving back to some of the medical trainees, just as I've received such great mentorship, not only from Duke, but over the last many years that I've been training in medicine. I hope to pay that back to some degree or capacity to residents or fellows or, medical trainees in general at some academic institution.